In this figure, we want to assess how arterial blood volume affects the blood pressure in those vessels. And it's important to regulate blood pressure as this is the driving force for perfusion of our tissues, meeting the needs of maintenance of homeostasis through capillary exchange. Now, blood pressure in the arterial circuit is proportional to blood volume in those vessels. That's much like saying the pressure in a balloon is determined by the volume of air in that balloon at any given moment. Well, in terms of our arterial circuit, a flow-through circuit, that volume is going to be determined minute to minute by the ratio of the inflow to that circuit, cardiac output, relative to the outflow of that circuit. And that outflow is determined by the resistance of these arterioles, determined by the smooth muscle constriction or dilation, the resistance. And so if we look at Poiseuille's law down here, we can see that flow through a vessel, Q, is proportional to delta P, the driving pressure, divided by the resistance that opposes that flow. If we extrapolate that to an entire cardiovascular circuit, what we could say is that flow is cardiac output, and that equals the driving force, blood pressure, divided by resistance of all the vessels, total peripheral resistance. If we rearrange that equation, we can see that blood pressure equals cardiac output times total peripheral resistance. Well, we just said that right up here, right? Cardiac output is our inflow. That equals heart rate times stroke volume. And our outflow is determined by that total peripheral resistance we just mentioned, right? Outflow is going to be inversely proportional to that resistance. So if resistance goes up, outflow goes down, and we're trapping more blood in here, increasing the pressure. That's why vasoconstrictive agents, hormones or neurotransmitters, will cause a rise in blood pressure. If we have agents or factors that increase cardiac output, right, our sympathetic output, for instance, might increase heart rate or increase contractility of the heart, increasing stroke volume. That would increase inflow to this arterial circuit. When inflow exceeds outflow, the volume here rises and our blood pressure goes up. Once again, it's essential that we maintain blood pressure, as too high of a blood pressure, hypertension, can damage blood vessels, while low blood pressure can lead to inadequate perfusion and maintenance of tissue homeostasis. Finally, if we look at blood pressure over time, we note that it's not quite steady, right? It's sinusoidal here. It goes up and down. And it goes up and down because the volume in the arterial circuit is going up and down over time. If you think about it, cardiac output is intermittent. We eject our stroke volume, and then we have to pause and refill before the next contraction cycle. Runoff, on the other hand, at the smaller vessels over here on the right, runoff is continuous. And so when we eject blood into the arterial circuit, the volume there is rising faster than it's being released, and we reach our systolic pressure, or peak pressure in the arterial circuit. Then we stop ejecting and runoff continues, pressure falls to the low point, which is our diastolic pressure. And so that gives us this systolic and diastolic transition due to the intermittent ejection of blood. Chronically, we want to make sure that our inflow and outflow are matched so that our blood pressure can be maintained.